For the public that's not here, this is being streamed today. So I want to welcome all that are looking on using your cell phone or your computer, and welcome those that are here from DOE today that are going to be assisting us with where we got to go. I'd like to just give a brief explanation of what we have in front of us, why we are taking this bill up, and why we're doing it so early in the game of subcommittee work. HB 742 is a bill that deals with the issue of catastrophic special education aid, previously known as catastrophic aid. And it is a topic which during the Education Funding Committee work this past winter, we dealt with this issue via several bills, and it caused a lot of consternation in terms of trying to, where's the data coming from? What are these figures based upon? We know it's a huge expense in our education programming, and what are we going to do about it? Well, this subcommittee, after meeting with the speaker, is recognized as a committee. There is another bill setting up a commission to look at the issue of special education funding. This committee right here is tasked with the purpose of delving into the issue of catastrophic special education aid, differentiated aid, not differentiated, special education aid, and to try to come up with some resolutions for how are we going to get some of that data and information needed and to make these decisions. So in front of you today, I put an agenda, and the subcommittee purpose, this subcommittee is established to consider HB 742, as we well know. That's an act requiring catastrophic special education state aid funding to be drawn from the Education Trust Fund. The word catastrophic aid is in the act title of that bill. So, and to more broadly study and make recommendations regarding special education aid, reference the RSA 186C:19, and such other matters as may be related to the costing and implementation of programs related to special education aid / differentiated aid. The outcome that I'd like to be able to see from this, and the reason why we're starting so early on a subcommittee, is that this is an issue which has been discussed session after session after session without much resolve. The issue of this formula which we have, and everybody's familiar with the formula, 3.5 times this, it goes up to 10 times this, and etc. We've seen bills come in, drop it from 3.5 to 2.5, drop it to 2, drop it to 1.5, drop it. And the reason being is local districts are shouting right now that when we have to end up prorating this money, we end up downshifting money and responsibility to the local school districts, which have not built that in their budget. And as a result of that, they're having to dip elsewhere in that budget to come up with the funds to support this particular program. So to the detriment of Paul to pay Peter, that's what's going on in the locals. And people are saying, Uncle, it's enough. And we're saying that same thing. Can we get a good handle on this program? And so, yes, I think we can, but what I'd like to very much do is make sure that we can send by November, the end of October, because that's when we have our retained bills come back to us, we have to act on them. We can send a clear, direct message to the Department of Education, to HHS, Medicaid. We need some resolution. We need the information. We need the data. If we're going to back it off from 3.5 times to 2.5 times, are we going to have to project from that 800 or a little under that number of kids which are receiving the catastrophic aid, and we're going to see our curve go up as far as the number of kids who are qualifying and the cost. And we always have seen in the reports coming back from the department, indeterminable. We've met with the finance people over there, and a lot of the information we're looking for isn't there. So our goal is to send a directive, administrative letter by myself at the end of this, because we're going to have to come up with recommendations to this particular bill, which will go into the legislative hopper or process. But I'd like to be able to send an administrative letter from the funding committee. Here's what we'd like to see you start working on right off here. Get us some answers so we can make proper legislative sessions or law. So I've got a copy of today's agenda here. And I explained where I'd like to go here. We need to identify a subcommittee clerk. This is being streamed. Somebody would like to help us take some notes here. I'd like to review quickly some background information which we have. There's a packet of material that subcommittee members have before you. And then get into a presentation which is going to be done by Henry Lipman from HHS, who's in charge of that Medicaid Direct program, and to see how that interacts with the program we're dealing with. We've always said, where's that line? Does it move back and forth, or are all people districts participating in it or not? We don't know. And he does have more of an understanding on it, as well as I know that the Department of Education can help us out in that matter as well. Looking at that packet of materials you have, I'm trying to go real quickly here. The packet of material, it says packet items, and they're materials that we have discussed. It would only be those people in the subcommittee. I do have, for those which like, I have 3 extras right here. You're welcome to come get them if you would like. Going through this packet of materials, the first one simply is a sheet which shows you from year 2000 through 2023, the number of youngsters that have IEPs in our ages 3 through 21 that have a disability, one of those 13 category areas, and it shows you the number of students in those particular categories. The second sheet is a sheet that we got from Brian Eaton and the folks over in the Department of Education, projecting out in 100,000 cost brackets of the number of students that we have that are qualifying for the special education aid. And, you know, we're talking now those students which are costing more than the $70,000 per pupil. So we've looked at that before. Also, there's if you would like to discuss as we go through, we can, but I'm trying to get done before Henry.
Sure. Just a question on that last part.
Yeah.
On the 100K cost bracket.
Yeah.
So just picking on the one at the top, 500K to 600K.
Yeah.
So what the way I'm interpreting this is in 2024, there were 4 students that incurred costs that were provided services that cost the district between $500,000 and $600,000 per student.
That's
for each
correct.
of those students.
Yes.
Okay.
And you'll note that as you go down in costs from that 500K to 600K bracket, the number of students will gradually, slowly increase. We've tried to take this data and move backwards beyond these students right here into the category of what would we project for 70,000 or 60,000 or 50,000. And that's just a guesstimate. But you will see that it goes like this, and then all of a sudden your curve's just going to climb sharply like a cliff. Mm-hmm. And so if we back off in costs, what are we going to do with the costs for the program to the state? Going on, moving quickly, we'll get into this as we discuss. The next one is a sheet which is information that is collected by the department. It's the Bureau of Education, Bureau of Special Education Support, the data fact sheet, Individuals with Disabilities Education Act, Part B, Indicator 5. And we talked about having, and this backs into the differentiate aid a little bit, but where there were the categories of how much time is spent in the regular classroom, how much time is spent out of the classroom, how much time do you have with support. We had talked at one time several centuries ago of trying to allocate based upon the cost for each IEP. Some, for example, it may cost a lot less for a student that's having a half-hour speech therapy a week or twice a week versus a child that has traumatic brain injury. huge differences. And we were trying to wrap our hands around that as far as can we build a formula which would provide more money in the differentiated component for those categories. We found there's kids crossing over from one category to another, and it was very difficult. This is the only information we could get from the department and for these categories A, B, and C. And you can see in the next sheet over, we did get communication from the director over there back in 2024, January 18, projecting the number of students in each of those three categories. That may be one way we could help project going backwards, but it's going to be just another very guesstimate. The other sheets which you'll see in the packet are following up with the several projected ideas that we have as a committee have talked about in terms of allocating funds for differentiated aid. One was by the three category process. The other one was just recently with caseload, the average caseload management. The following sheets are all sheets which I think we've been presented before when we had the overview from the department on special education aid and expenditures by school districts. We will look at that. And the last information in the packet is some that I've received from the Jennifer Ford, who is our research assistant on Education Commission of States and a number of states that have different ways of funding special education aid, which we will be also using Jen to do some research for us. That's enough of that one right there. There is also another sheet which you do have. It's one like this. We did contact one state, Arkansas, and they have a different formula. They don't wait for students to get to that 70,000 mark before they say that the school district's responsible for the first 15 grand. And then the state kicks in from 15 up to 65% at 100%. And then it goes to an 80%. That's good for the students which are probably to the locals to about $200,000, $210,000. But you go beyond, it all ratchets back to the local. And it could be a very expensive methodology. But they also do some auditing there of all the IEPs to determine what kind of numbers they have at the various levels. So that takes us through some of the background information we have. There are also several audits which we do have. One audit which deals with education and the due process resolution problems to which we've had in the past process. And that's really not really relevant to what we're doing here today. There's another performance audit report which is due out, but in contacting the people at the LBA, that won't be ready till the end of this year, if we're lucky. So we are going to have to, get into this pretty much working cooperatively with the department and with HHS and try to come up with some directions and ideas of how we're going to try to resolve this issue of the huge costs associated with this. This has nothing to do with the policy or saying, Mr. School District, you shouldn't be providing this service. So that's not where we're going. We're staying on the dollar bill and what this costs, the funding portion. So I'll open up a few questions. I don't see, oh, here's Mr. Lipman. Probably hadn't find a meter or something. Henry, why don't you sit right there in front? And we're just wrapping up the introduction remarks here by myself. I'd like to ask the committee, are there any follow-up comments to where we are at this point in time? You're not on the committee, but I also want to say we have some people that are sitting here from the whole committee. I will be glad to take questions from them, but I like to do that after we have the presentation from Henry here. Now, why Henry? Why the department dealing with Medicaid? When we get to the...
Do you want to choose the clerk before we dive in?
Okay, I've been just reminded, do we want to choose a clerk?
Can we pick a clerk volunteer who's on the committee?
Is there a clerk volunteer on the committee?
This is too many.
See, if we were a Senate, you'd have an administrative assistant sitting here doing it all for you. We're not that. Do we have somebody who would like to? It is streamed. Can we use this? No, we can't use the streaming as. be really great if we could. Does anybody want to take notes as we wail through this? Is there anybody that's not on the subcommittee but on the Education Funding Committee that'd like to just take notes today?
Mr. Chair, I'll take notes today.
Okay, thank you,
I'm
Reverend.
not sure I'm committing to the ongoing.
Thank you very much, Representative Naaman. I know we've all done that and you're all kind of hesitant.
Next meeting, we'll be talking about the value of consistency, Representative Damon.
Okay,
Skills are having to back right out if you do that.
well, yeah, consistency is kind of fun to have, isn't it?
Gentlemen, stop.
Okay, so why do we want to be talking about Medicaid right out of the blocks here? If you have a student that's at that 70,000 mark and now you're getting to the area where the department's considering where we are going with the catastrophic aid and that portion of our allocated funds, they're going to look at what the invoices and all have been for up to 70,000. And one of the questions would be, have those services which really should have received some support reimbursement through Medicaid been addressed? Has the school worked with them at all through the people that are qualified to do that within the school and with the HHS? That's part of it. And then also we get to the other end of the spectrum where we have students that are in residential placement, and where does that line start and stop within that? So I don't want to go any further because I'm not the expert in this area. The man that's the expert is sitting in front of us today. And so I'd like to welcome Henry Lippman to our committee, first subcommittee session we've had.
Thank you, Mr. Chair. So Medicaid does provide support in schools for individuals who are Medicaid eligible. So one of the primary points in terms of where Medicaid funding could support schools is if someone is Medicaid eligible. We do have in New Hampshire today a Medicaid to Schools program. We have 172 school districts that are enrolled in that program. What we saw sort of pre-pandemic versus post-pandemic, we've seen, obviously during the pandemic, we saw a decrease in the utilization because there wasn't in-person learning. But coming out of the pandemic, we're seeing still suppressed amount of utilization of that program compared to historicals. Some of that, I think, is that in order to claim Medicaid funds, you have to know how to Medicaid bill. And that, I think, for some school districts is a bit of a challenge in terms of do they have the workforce necessary to do this and the contractors sometimes to be able to do that. But essentially just how the program works today and how it will work starting July 1, 2026, I just touch upon that. So basically, schools today, if they bill a Medicaid services, they are entitled to half of the Medicaid fee schedule. The other half is considered their contribution or certified public expenditure for purposes of claiming, the state of New Hampshire in nursing homes as an example, that we provide some payments based on certified public expenditure. New Hampshire Hospital, Glencliff, they're all ways that the federal match being 50%, right? Generally, that the way that you demonstrate that is by doing what is otherwise known as a cost report of some kind. We haven't done that in Medicaid schools. The cost report structure, we've instead assumed that half of the Medicaid rate equals half of what the school cost is incurring. In other parts of the state government that have drawn,
Henry, can we ask questions as we go along? 'Cause,
Please.
I've already flown by two questions tonight. Representative Londo has one. Representative Londo, do you have one?
Yeah,
first?
yes, yes, I do, and I think the clerk has one as well. But did I hear you say that when we talk about Medicaid, we talk about a state share and a federal share.
Correct.
And 50-50. And so in a Medicaid to schools situation, is the state share, who is Who is providing the state share?
So it's technically the school.
Okay.
Okay, the school district. Sometimes it's known as a LEA,
Right.
local education administrative unit. So that the 50% is coming from the school. Now, I don't know necessarily the school side very well, but in terms of tapping into the fund that's available, I think you tap into it probably at a whole dollar amount, not at a 50% share, right? So it, where we are in terms of the Medicaid program and the 50-50 share is that the 50% of the fee schedule probably does not today recognize really what 50% of the cost the schools are incurring. The federal government has asked states in this area and others to convert to a true certified public expenditure, which means that the schools will have to demonstrate their costs, and that they'll get 50% of that. That should, as it has in many other states, lift up the amount of money that schools actually get reimbursed from Medicaid. In addition, doing a true cost report will allow the schools to pick up some of the administrative overhead that's not included in the Medicaid rate. As an example, if they have someone in the, say, the principal's office who does the scheduling of the appointments, that part of their cost could be recovered. And so by July 1 of 26, we have to convert to this actual cost-based methodology. And the department applied for a grant, which we were awarded of approximately $2.5 million. We are obviously watching what's happening at a federal level in terms of grants, but we've heard nothing that is affecting this grant. But the purpose of that grant was to acquire a vendor to support the department and schools in implementing such a methodology, and that would be something that we've actually done an RFP on. We work with the Department of Education somewhat on that. They actually gave us a couple of individuals from the regulated community, so to speak, from schools to participate on the selection of the vendor. It hasn't gone to the point of going to governing council yet into contracting, but we're actively working on that. We actively have the grant. There's, I think, a big effort that needs to be done to help schools navigate that new system. That being said, I think it's to everyone's advantage for schools under the Medicaid program to get 50% of their true costs as opposed to 50% of the Medicaid fee schedule.
I'd like to follow up just so I can Representative Damon. So, Mr. Lippman, when we're talking about this true public school expenditure, is that the actual cost of school district A and B and C, or is it an average of A, B, and C? How are they coming up with that? It certainly costs more for services in a small town where services have to be brought from somewhere else to support versus being in a larger community where services are there.
It would be actually A alone, B alone, C alone. It's not a mix, an aggregated mix. You have to have. There's a concept called reasonable costs, like you can't throw in cost of like a golf membership or something like that. But generally, or you can't pay a physical therapist, as an example, $1,000 an hour. I mean, if you're being reasonable, the reasonable costs will be included and allowable.
Representative Damon, then Representative Spilsbury.
Thank you, Mr. Chair, and thank you for helping us with this. Is there a document of reasonable costs by some code for the various services or some itemization?
We haven't developed that rule yet in terms of, because we've got a little time to go to do that, but generally we'd want to look at what is in the market, and if the general market rate is whatever, $75 or $150, and someone's coming in 4 times that amount, that's not going to be viewed as reasonable upon audit. But we haven't developed that rulemaking yet. But I think generally we have the broad terms of the Medicaid program are you're supposed to set the rates for quality, efficiency, and economy, and that the eye of that's in the beholder. As you said, a small school district that is required is going to do something compared to a large city is going to have a different cost structure.
Representative Spilsbury?
Thank you, Mr. Chair. I'm going to ask everyone to bear with me because I come to this task with no background in the area, and I'm not sure that I'm really understanding the mechanics. So I'd just like to run through what I think I heard and understood and see if it's right. So you're saying that for any student who is Medicaid qualified, the Medicaid program will pick up 50% of the costs. And for any student who's not Medicaid qualified, then the district with whatever state contribution is picking up all of the cost. Okay.
Yes, you have that.
And you're saying that currently the determination of the costs is based on a schedule of services rather than actual costs, but that as of July 1st, 26, the DOE and the districts and schools are required to move over to an actual cost basis. Is that correct?
You're doing great. Yes.
Okay. So essentially, to prepare for the July 1st, 26 implementation date, the schools and the districts have to implement a cost accounting protocol that they've never previously been required and probably haven't done, right? To determine actual costs and do that by using various cost accounting metrics to break out shared costs and to allocate administrative costs and embed them into some figure. So what is that correct?
Yes, except I would add that they're part of that grant is intended to have a vendor who does this in other states to help
That's the
our
2.6
schools.
million,
2.5 million.
2.5 million.
Yeah.
So what's the status of that effort? And are we in a position to be prepared by July 1st, 26? And are we in a position perhaps to start taking advantage of that data as it gets implemented? And what's the timetable?
So we have, as part of the whole process of applying for the grant and trying to secure a vendor to support, and it was a competitive grant process, a competitive RFP process. We actually had stakeholder meetings with schools and trying to get their input on what would be a reasonable time frame. And we built those types of things into the request for proposal. And so I think that we're, assuming we are able to get through Governor and Council cleanly and there is no disruption of the grant, I'm pretty confident that July 1st would begin the process. So what would actually happen on July 1st is not much different than what's happening today. The cost report is sort of a settlement process. If you can kind of think about the payments that they receive will be an interim payment that will then be settled up against costs. So if a school district incurred $1 million worth of billings and the cost report said it should be $1,300,000, after they've submitted the cost report, the state would claim another $300,000 for them, and so they would get a supplemental payment thereafter.
Henry, following up to where Representative Spilsbury is, you open up saying there's been a suppressed numbers since COVID as far as participating in the Medicaid program. Now, if we're looking at having stakeholder meetings, would those now participating school or districts, what are we doing about, getting this program going with those schools which are not participating and have not been involved?
I think it's a big effort to get to 172 school districts, and we have not even a full-time equivalent in my unit of 33 people to run the whole Medicaid program. So that's why we're looking for vendor support to do this, because we need some help. We can do a lot of, processing claims that's no extra effort on our part. Getting the technical documentation in place, that's really, we do that all the time. I think it's getting out and working with the school districts and the business administrators and so forth to help them and to give them the tools to be able to do the cost reports. We're not expecting them, I think, to create something out of whole cloth that will have templates and different things that they'd be able to use to do that. But, a good part of the contract deals with, providing that technical support to schools. The problem is if we can't convert as of July 1st, what we are doing today will no longer be, we won't be able to do it. There's sort of a deadline for us to make a conversion.
Representative Damon and then Representative Luna.
Thank you. So following up on the question of districts that are not participating, what data do we have on what amount of children who would qualify for Medicaid are in fact enrolled?
That I don't have an answer to. I would expect, in New Hampshire, about 1 in 4 children are enrolled in the Medicaid program. And that obviously varies by community, but that is sort of the statistic I can share with you that might give you some correlation there. The other thing too is that the kids who may need the types of support in schools, whether that demographic plays out to 1 in 4, or it may be a higher concentration in certain areas.
Yes, you may.
And has that 1 in 4 been consistent over time? Do you know?
During the federal public health emergency, when there was a requirement for states to keep everybody enrolled, it went up. But also, Congress passed in 2023 a requirement that went into effect January 1st of 2024 to provide 12 months of continuous coverage and for children. So the churn in the Medicaid program for children should be less than it has been historically. And so I think the 1 in 4 has been fairly stable. I think economic conditions can drive Medicaid enrollment more than anything else. New Hampshire's economy has been, on a relative basis, pretty strong compared to other states, and so I think the 1 in 4 I think is a pretty good sort of benchmark to use. It could probably vary a little bit depending on economic circumstances.
Representative Luna, did you?
Thanks very much thank you very much, Mr. Lippman, for being with us this morning. How do schools currently know if a service they're providing is Medicaid reimbursable?
So anything in our state plan, which is the sort of the coverable services that's appropriate for the school setting, can be coverable. A lot of the services that are billed for are related to rehab assistance. So if you kind of look at the other factor, right, it has to be in their IEP plan or their 504 plan or the other plans that are available, that really the purpose of the Medicaid to Schools program is to help individuals who have health conditions to be able to accomplish learning in the school setting. And there's some people that have disabilities that need support to be able to participate in that setting. That's kind of where we come in. So it could be, your rehabilitative services. It could be a child that has to be on a medication where the school nurse needs to be there to, supervise the administration of it. Those are types of services that I think a preponderance of what is provided in the school setting: your speech, your physical therapy, your occupational therapy, rehab assistants, nurses. You may remember just before the pandemic, we kind of kicked in. There was that to try to bring our program into federal compliance in some areas in terms of licensed professionals. One of the things that we did do is make sure that school nurses could delegate certain things within their Nurse Practice Act in terms of supporting students in the school setting. And that's another piece of the program, is that the people who build the program have to be, licensed by our Office of Professional Licensure in their respective discipline. There's except rehab assistants are supervised by someone who's licensed, but the types of services that are being given are generally fall into that big bucket.
Follow up on that?
Yes, and then Representative Peoples.
Yeah, yeah, yeah. So thanks very much on that. And actually, a couple of questions sort of come up on that. With respect to OPLC licensure for certain services, do services that would be provided, or would services that are provided by, let's say, a special education teacher who's certified by the Department of Education for, I don't know, let's say like activities of daily living and that type of, would that be a reimbursable expense?
So I think if it's education versus healthcare, that's where it kind of, and sometimes that area is a little gray. But generally it would be, if they're not licensed in a healthcare professional way, it generally would not be.
Okay, and then the other question, I mean, you talked about students that have either IEPs or 504 plans and having those services documented in those plans. But would students that don't fall under special education services like IEPs and 504s, but otherwise have some medical needs that are provided through the school during the school day, would those be Medicaid reimbursable, potentially Medicaid reimbursable?
I guess I'd like to give you a more direct answer than I'm going to give you right now. And so I think that generally that we're seeing is we require, a physician order, right, which I think the 504, the IEP plans have, and we require parental consent. So I guess if there are other forms of plans where that would fit in, and I don't know that I know all the different types of plans that are in the school setting that can be used, but the elements of, there being a physician order behind it, that there be parental consent for both the services and to allow to bill Medicaid, I guess there could be some possibility there where some of that could be covered, but generally it's driven off of the plans that are in effect.
Well, that's very helpful. Thank you.
Representative Peoples?
Thank you, Chairman. Thank you for taking my question. You were talking about this vendor that you're seeking through these RFPs. Would it be possible for us to get a copy of the RFPs that you've submitted to the DOE and to other entities that may fill their role? And that vendor that you're looking for, is that a software vendor? Is that an implementation vendor? I guess what I'm looking for, is there a way through this process to get further data to help us make better decisions? Just want to know what that scope is if possible. Thank you.
So the RFP is a public document. We did an RFA first, or an RFI, to get information from the regulated community, if you will, to get their input on certain things that we use to improve the RFP. I can give you that information right now. In terms of we're now in the vendor selection process, and when that comes up for a vote at Governor and Council, that whole contract and will be a public document. But in part one or part two of your question, they're probably all three. They have some software, they have technical assistance, and they'll be supporting implementation. So those are the three elements that we'll be looking to have there. They'll have a call center for questions that schools can call into and get some advice on the aspect of claiming for costs. There's actually the cost component there's a cost report, and there's also a time study component of it that is used to develop like the overhead allocation for certain support functions. And again, we're not cutting new ground here as a state. There are many states that are doing this already, and I think New Hampshire has covered more services than some states have, but in terms of moving to this methodology, just based on the way that New Hampshire is organized with many small school districts as opposed to larger school districts, I think that's been the challenge, is having enough knowledge base at the school setting to take advantage of the program. Medicaid is, it's not a simple thing to just pick up and learn without some background, some training.
Thank you.
Representative Spilsbury?
Again, slogging through things to make sure I understood them. To the extent that there's a 50% share taken up in Medicaid, that would be entirely federal funds.
Correct.
Right. And we're talking about all special education services, not just those that are reimbursable to some extent at state level under the catastrophic aid program, right?
I think in terms of that, I would qualify it to that are related to healthcare component, not
Yes.
education. It has,
Representative Luno's question was very important for me. So it's just the portion of special ed services that are medical related as opposed to purely education, but it's from alpha to omega, including those that are just absorbed at the district level below the 3.5 multiplier.
that part, I have no expertise in terms of the
So we'll
yeah.
that's an important question for me. I assume we're talking about all services from small amounts right on up to the 3.5 threshold and beyond. But that's at some point I'd like that clarified.
I'd like to follow up with a little bit of question on this, unless you had more, you were.
Dave looked like he was trying to clarify.
Right. So and this may be what you're getting at too. I think what we're looking at here is the Medicaid reimbursements, particularly the federal share for the Medicaid reimbursements would be netted out of the district's cost
Well,
before the.
you're leading to my then subsequent question, which is, are they? So when we see the catastrophic aid kicking in at $70,000 and on to 500, 600,000, is that net of the Medicaid?
I think where you're going, Representative Spilsbury, is exactly what you look on your agenda at 5B. Have all reimbursement requests been reviewed to determine whether the district has incurred a special education cost? Yes. And to determine that Medicaid and other funds are obtained prior to requesting special education aid funding. So leaning into this, if you have a life skills teacher that's teaching life skills, doing in conjunction with an IEP, that individual cannot supervise your program it's not a licensed nurse, it's not a speech pathologist with the C's, it's not your folks which have that health orientation. So when I'm going now to the next step of trying to get beyond that 70,000, who's going to come down and do that auditing to ensure that if there was Medicaid support, that 50% portion from the feds, that's done. So, okay, that's going to be excluded from that $70,000, I would think. Because the district has to spend the 70 grand first before they're going to get the special education aid. So that's part of my question. The other part of my question was, if in fact they haven't gone after the Medicaid and that's been a portion that has been written into that IEP, maybe a neurologist at the hospital had written in through the IEP that this child's receiving these services, and if the district hasn't delivered through, maybe they don't have any people in that small district, maybe it's all contracted service out somewhere. Who's going to ensure that that the school district or the state's not going to start absorbing this cost, which should have been taken care of by the Medicaid? You find it's kind of a long, drawn out question.
I get the question. Just by way of background, I spent 9 terms as a city councilor in Laconia, and I was the finance chair there. And we approved high level the school budget. So I'm a little bit familiar with things, but I think the detail in terms of how to claim against the 70,000, I have no expertise to bring to the table on that. What I can tell you is talking with the commissioner of education, kind of thinking about, looking at the reduction and what we're seeing in terms of claiming Medicaid, that if there are services that are health related that support education, then in terms of, funding from the federal government to support this, then we as a state are missing that opportunity. And that's, I guess, it's really something I think the Department of Education and others would need to sort of get their arms around fully. I can bring to you what it takes to be able to access federal funds to support healthcare related concepts. I think that's just by way of background. I think looking at sort of one bucket rising greatly, like I think we're now investing $1 billion into that fund, and the other component going down. It could be a spurious correlation, or there could be some opportunity there, and I'm just bringing to the table to both the Commissioner of Education and to the committee here today that we may be missing an opportunity in terms of some of the federal support that's available to support healthcare services that support education in the schools.
Henry, I'm going to just follow up a question and let the rest of the committee ask questions, or you go forward. Have you, in working with the commissioner, projected, I estimate that you are missing this amount of revenue by not applying for this or seeking reimbursement for this? Have you any projections of what we are missing in terms of federal dollars?
I think that there was a study done before I actually became director in the state. I've been the director for a little over 7 years now, that sort of looked at this concept a while ago, and I think it was multiple millions. It's not, it's not approaching billions, but in terms of general fund appropriations, I would guess that it's somewhere maybe in the order of between 50% of what is actually claimed. There could be an increase of that much in the Medicaid program.
Representative Damon.
Thank you. Just to clarify what you just said, so there could be as much as a 50% in the Medicaid to schools, or in Medicaid for the state for everything?
So in the Medicaid to schools program, that we could be claiming potentially as much as 50% more. It may not. I think we were 8.8 million in the last year. We could be, in the mid-teens as an example. I think that there's a component of workforce. Obviously, there's a component of, I think, the challenge of mastering Medicaid billing and what have you, that and that the federal government has required, and this goes back to 2018, a higher level of compliance with what it means to bill Medicaid. That you just can't. Someone who's certified by the Department of Education isn't necessarily qualified to bill Medicaid directly. That it requires a healthcare license, if you will, and that in terms of the documentation that you need to support your claim, that the expectation is that schools, while a different setting, still have to meet the requirements of documentation that any claim has. That it begins with, are you providing the service to a Medicaid individual? Do you have a physician order? And so forth. And some of that documentation, the way schools have been organized, been hard for them to master.
Go ahead.
Excuse me.
And then you have a question.
So is it, excuse me, so is it correct that the billing to Medicaid is going from your department with information from the school districts or DOE? It's not that the districts are billing the federal government Medicaid.
the school districts do bill the state Department of Health and Human Services, the Medicaid program. The claims are processed there. Whatever, if the claim is for $100, and the fee schedule is $100, we would pay 50 back to the school.
Representative Spilsbury?
Yeah,
Representative Luna?
thank you. I think I missed the figure. What did you say was the most recent amount of Medicare reimbursements and the potential increase? I heard you say mid-teens or something.
I'd say that we did 8.8 million, I think was was paid to schools in 2024.
8.8 million.
Yes, and I think it's probably, I wouldn't be surprised if it would be in the mid-teens, if you will, of, anywhere between 4 and another $8 million out there that might be available in funding.
Okay, so we're talking about actually a much smaller figure than perhaps I had imagined this far into the conversation.
Yep.
8 million plus 50%.
It's not chunk change.
It's not jump change, but it's not a game changer.
Yeah. Representative Luna?
So thanks. I wanted to clarify that too. So what I heard is that the 8.8 million, that's the federal share that went to reimburse
Correct.
schools.
And it had been, I think we had been pre-pandemic in the mid-teens of claiming, if you will. And I think that from the base that we're at, a 50% increase is not, wouldn't be a hard number for me to feel comfortable with. So we're talking, $4 to $8 million range more in general funds. But again, not knowing the entire universe of whether we could get higher school participation, it could be more, but I'm just, in terms of looking at what we're doing today, it's not going to go from 8 to like 30.
Okay. And thanks very much on that. And going into the Wayback Machine, and I honestly, I don't remember if this was pre-pandemic or post-pandemic, but we worked on this. There were some significant changes being proposed at the federal level for Medicaid to schools, and we needed to do something at the state level. Were those, what happened there?
So that's what I was sort of talking about in terms of sort of stepping up what schools did. It just coincidentally, I think it was like in August of, I think would have been August of 19, before the school setting, that we were working on implementing the changes to bring us into greater compliance. Teased out of that was issues that we had around some of the, that certain providers weren't licensed by the Office of Professional Licensure and such. And just coincidentally, I think the Senate and the House fast-tracked it, and it was implemented on March 10th, which was just happened to be a week before, everything else hit the fan, if you will. And we were fortunate that we had done that because we were able to do a lot more in terms of, we allow telemedicine and such, and it put us in a better position to deal with the workforce situations and the school, closure situations that we faced.
Couldn't have been better timing.
Yes, it couldn't have been any better.
Henry, several years ago, we dealt with an issue where we had to decide, or we were trying to figure out, we had certain equipment in schools which was necessary to support the medical side. The parent also had similar equipment at home. Who received the Medicaid support?
So I think if you're talking about a piece of durable medical equipment that was used out both in the setting,
Yeah.
it probably would have come through their regular Medicaid insurance. But again, individual circumstances, don't want to have to look at very specifics of a situation, but I would think generally would fall into their general medical benefit under Medicaid.
So the school would have to then cost out that equipment and pay for it themselves, rather than Medicaid support, seeing that the wheelchair and all was at home.
I think if they're going to be using it all over, if they were using it only in the school setting, that would be, I think, like an adaptive device to to function in the school setting, that could be picked up by Medicaid. But if they're using it generally throughout their whole life, I think it would be picked up under our Medicaid program outside of the school setting.
Okay, I'd like to shift gears just a little bit and then get to Representative Spilsbury. Several pots we have here. We have the special education aid monies, which is in some cases supporting students and children that are in hospitalization, who are in residential placements. Who oversees and who audits, for example, the person that's sitting in Tennessee or some such place receiving our Medicaid, but does your department have that responsibility, or does our state Department of Education have that responsibility?
So I think it's probably a combination effort. I've dealt with a couple of cases directly that were kind of highly complex, where our medical directors looking at the services that are medical in nature, and versus the residential component. So there is, I think, if the child is DCYF involved, that they would be potentially involved in that. There could be a situation which is not directly under my control, but we collaborate with them within DHHS. And then there's sometimes children that have severe disabilities where, it's not just the Medicaid program, but there's a unit that deals with, special healthcare needs children that are outside the managed care program. But generally, we look to support if something is coverable by Medicaid. We'll work to get that covered, as opposed to either having the school district pick it up or the state or whomever. But it sort of comes up on a case-by-case basis based on what the circumstances are. And sometimes there's a period of time where it can be picked up, and then it reaches a different level where it can't be picked up. And that's sort of like in terms of, is it continuing to advance a health issue or not? But I do think that what probably deserves to be looked at more is, I don't really understand what's going into the special education, that fund where schools are tapping into that 70,000. Maybe the universe is bigger than what I said it is. I'm just doing it based on what I see on the Medicaid side. But if what's going into that bucket are things that are healthcare related, I think there's a reason to look at to see whether the federal government should be picking up a portion of that. But I also see from the school standpoint, the incentive isn't necessarily to get half of what they're claiming, but to get the entirety of it. And that's where I think we all ought to get comfortable that we're accessing the right bucket to pay for the services.
Further question, Representative Spilsbury.
Thank you. So given this important distinction between the portion of the special ed services that are medical in nature versus those that are more purely educational, I want to see if there's a strong or reasonable correlation between this discussion and the point about the RFP and the new reporting support requirements that take effect July 1st, 26. So first of all, whatever occurs in the context of that July 1st, 26 reporting relates exclusively to the portion of the services that are Medicaid eligible, in other words, more medical in nature, and therefore won't necessarily capture what's spent on the same student that is not Medicaid qualified. Is that correct?
Correct.
It gets us part of the information we're looking for, but not all of it.
I think in terms of what the coverage would be, in terms of looking at the whole picture of a child who getting tapped in the fund, that's something I don't think we're set up today to really evaluate, because I don't really get, unless they approach Medicaid, we don't really get any insight into the situation.
Great. This is becoming clear for me that we're talking about a subset
Yes.
of the total expenditures that we otherwise classify as special ed and that may be eligible for CAT aid reimbursement. And this, I guess the second question along the same lines is, what do you anticipate will be the nature of the data that we will get after July 1st? What will it actually show us?
So we'll see what claims come in, right, in terms of actual billings, right, because they'll continue to bill, and we'll be able to see the number of school districts that are participating, the amount of services being provided, which we have today, but we'll, after we get to the cost reporting side of it, we'll be able to see whether how much more the school districts are able to draw down in federal funds than they are today. So a school district that, as I said, that may be drawing down $1 million in funds today may actually be able to draw down, say, $1,300,000 as an example, providing the same services, but doing it on a cost reported basis and being able to claim some of that overhead cost that they can't claim today, that they should see an increase in what they're able to net out of the program for Medicaid.
So one quick follow-up.
Just-
So are you thinking that that development and that discipline will help boost the 8 million back in the direction of 15 million, or is there no correlation there?
I think that there is a correlation that if you think about if the Medicaid fee schedule, people don't see Medicaid as a generous reimbursed program, right? To put it mildly, right? But let's say we're paying $30 a unit for a half hour of physical therapy. The school district has to contract with a physical therapist at $100 an hour, right? That they're having to absorb 40 of that cost 100% themselves because they're only getting half of the $30, right? So if it goes from half of 30 to half of 100, that's what we're looking to get out of the conversion, if you will, to the new methodology.
Thank you.
Representative Luna?
Thanks very much, Mr. Chair. So, going back to the question that Representative Spilsbury referred to, the Medicaid fee schedule that we're currently using, is that who defines the fee schedule?
The department, based on legislative appropriations, and what we try to do is to try to tether our fee schedule to a percentage of what Medicare pays, and where there is a Medicare equivalent component. So ideally, we're targeting to get to 80% of Medicare, but it depends on the appropriation that is available to us. In 2023, there was a significant improvement in the fee schedule by the legislature. And I know in House Finance, they're talking about rolling some of that potentially back.
Right.
But, in the ideal world, we'd be paying between 80 and 100% of Medicare.
Right. So thanks for clarifying that, because I think that's going to be talked about some more the other side of the hall, the other end of the hall tomorrow. Right.
Right.
So, and then do school districts have to do anything, particularly with DHHS, to be able to seek Medicaid reimbursement from your office?
There is, you have to enroll in the program. You have to, if you hire someone from a school district as like a speech pathologist versus contract, you might have to get that person credentialed in order to participate. But basically, it's a record documentation to support a claim. Again, you need to be able to substantiate that it was in a plan, that there was a provider that agreed to it, that the parent has, that the consent is one time a year on the billing, but the changes in the plan, I think that's really under schools, that each time you make a change in the plan, I think you need to get an updated consent from the parent that they're aware of the change. But it's that, and then when you document your services, you have to be able to translate that to a billing code, right? This portion of service translates to, a unit of service under a particular discipline.
Okay. Okay. Great.
And
Thank
keep
you.
your records. That's
Yeah. Great. Thank you.
Henry, we have a number of kids that transfer from one district to another district within a period of a year, sometimes 2 or 3 times. And you may have a student that is a student receiving Medicaid support from District A, now they're in District B. How's that work? If District B is now a very small district without services, but now you have an IEP that's saying this, this, and this, how's it work in terms of continuing that support?
I'm not sure I have full insight into it, but, I presume this is where I think the education side comes into play here, right? Is that the purpose of the Medicaid is to support the child getting being able to participate in the education program. So, I mean, I think that either, and this is where I think I need your insights and school's insights and Department of Education insight is, are they tapping into, are they going without it, or are they, absorbing it 100% within the town or community's budget, rather than taking on the complexity of billing? Or are they, if it's an expensive student, are they making a claim over to that fund? So I think that there's several ways it could play out. We do hear that some small districts, rather than, trying to set themselves up to do that infrastructure, may just choose to absorb it. Then there are others that, may not be fulfilling all their requirements. I don't have direct insight into that. Be the fairest way to put it.
I think that's a concern, that some may be absorbing it. And then the costs are being thrown onto the other side of the coin here, to the state side.
Or the local taxpayer.
Or the
where-
local taxpayer, correct, yeah. Yeah. Further question, Representative Damon?
Thank you. This is separate from where you just were. I think it's always a little confusing, Medicare versus Medicaid. So would you confirm, is it correct that some of these children, these students, have both Medicaid and Medicare coverage? And if that's correct, what is happening in terms of any Medicare involvement in the funding?
There are, I think, a small subset of children that are both Medicare and Medicaid's dually eligible. The Medicaid schools, when someone is dually eligible, Medicaid picks up the uncovered portion of the Medicare, like if there's a copay or deductible. That's how we participate in that. In terms of billing within the Medicaid to schools program, I'm gonna have to check back on that myself in terms of how that plays out. In my time and overseeing this all, I haven't really picked up on that issue. But generally, our responsibility is to pick up the non-covered services. So in the school setting, I suspect maybe their Medicaid would be primary in covering that, but I'll validate that.
Thank you. Appreciate that.
Yes. You're not on the subcommittee, but go ahead.
I was going to ask you, but is it okay to ask directly? Or here, I'll ask you. So when you say you pick up, when Medicaid picks up the coverage but it's 50%, right? It's still at that 50% threshold when they say pick up what's not covered by Medicare. Yes?
That, I'm going to circle right back to Henry on.
So I think in terms of let's deal with a purely Medicaid student, it is the 50%. I think I want to circle back on a child that is dually eligible. I believe that generally, if they're getting services outside of the school setting, we would pick up the deductible and co-insurance. I need to verify how that we handle that when they're just in the school setting. It may be exclusively Medicaid in that instance. I believe that's the answer, but I want to verify.
So following up on another area, thank you. I'd like to track the dollar. So the federal dollar, does that go directly to the school district? And if it does, is there any CC or something where it's the Department of Education also is told that this district is receiving federal dollars, so that the state is aware of that?
I guess it could be aware today. What we are required to do under legislation is we share a report of the school districts that have participated and the dollars that have been claimed. That's where the 8.8 million comes from. But we have the capability to do more in terms of reporting there by school district and so forth. But that there really has not been the type of integration I think that we should have between education and the Department of Health and Human Services. But when a school bills us, what we do is accumulate for a period of time all the qualifying bills, and then we go to the federal government and say, we're going to pay out this much money, which we then do, and then the federal government gives the money to the state. That's how it works. So
Representative Colcom, you're a member of the committee, not the subcommittee, but the
Correct.
committee.
Thank you very much for that. So can I just have clarification? So does the federal government send the money to you to send to the schools, or do they send it directly to the schools? Because that's what I interpreted from your question.
to the Department of Health and Human Services, who then sends it to the school. And technically, what actually happens is we have to actually pay it to the schools, and then we get reimbursed. So the transaction can happen the same day. The state is, in all Medicaid situations, the state has to pay first, then make the federal draw, but they happen pretty close together.
When you're communicating, when this information you're communicating with the Department of Education, is that an annual report you do or on like the $8.8 million?
Yeah, it is an annual report to the legislative leadership, as I think it goes to the president of the Senate, the speaker of the House, the governor. I can't remember exactly what the legislation says, but it's typical to other reports that we notify on, and it's put on our website, I believe.
Representative Spilsbury?
Yeah, again, to clarify, it's the state's Department of Health and Human Services that's acting as the intermediary to manage the Medicaid delivery within the state of New Hampshire, right?
Yes.
And so, should we be talking to them? Would they know more than we can get out of this discussion?
I'm the person who oversees that part for the.
Oh, I was thinking you were in DOE.
No,
Excuse me.
I'm DHHS.
Very good to know.
State Medicaid Director.
Thank you.
Yes, DOE's over in the corner there.
Yes, understood, but okay.
If I'm
I thought
missing-
two different
if I'm missing
departments, but
something-
thank you.
If I'm missing something, I'm
And
certainly
the
would
purpose today was for us to just get a basic understanding, to some degree, of how the Medicaid to Schools program works and how it's integrated in with the special education aid. That's the whole purpose today. We will be meeting with DOE. They're here and they may be able to help us out if there's some questions, but the Rebecca Furdette, the director, is not here today because of another personal issue. Yes, Representative Luno.
Thanks very much, Mr. Chair. So, a few minutes ago, you made a comment that I wrote down that I found very interesting. It said New Hampshire should have better integration between the Education Department and DHHS. And I was wondering if you could elaborate on that.
But we do have a level of integration. We do we work together on. We had a committee that works with both frontline school districts and with actually the New Hampshire Charitable Foundation has funded. There's a national movement on Medicaid to schools, and we've had a sort of a local perspective there that we work together on getting grant money from the foundation, charitable foundation that helped put together through a consulting agency, JSI, to help provide some support to schools and navigating the program. But I think in terms, when I say better integration, is kind of looking at what's happening in the Medicaid to Schools program, what's happening in the special ed area. I think that both the commissioner and I independently kind of seeing what has been sort of headlines about the growth in this, and I'm assuming that some of what's there is healthcare related things, and looking at the decline that we've seen in the Medicaid to Schools program, that and the fact that we're required to change our methodology irrespective, that this is the time to kind of relook at how we're working together at maybe a higher level than we have before. It's not that we haven't worked together. We do work together. But I think we ought to be, given the tight constraints of resources that the state's facing, that trying to strengthen that collaboration even further would be to all benefit, because we're seeing what we're trying to work through this year is, this happens in cycles, right? Where we really struggle as a state to fund our things that we want to fund. And I think that having been on the city council side, I can see that if we're not taking advantage of federal funding, then either we're putting more on the local taxpayer, or we're putting more on the state, or what have you. So I come from a finance background, so I sort of see that this is a unique opportunity coming in front of us, both a challenge at a state level and a need to convert to a system that potentially will help us draw more funds. Let's make sure that, while we can draw more funds, that we're also drawing the funds that we're entitled to as a state.
So thank you very much for that. And I think that, this is something that might be the beginning of a whole nother conversation, or discussion. But I was wondering, Mr. Chair, if this could be one of the areas that we, as we look towards a directive, or as we look towards an outcome from this subcommittee, this working subcommittee, that this be another, that this be an area that we.
I think that definitely it's something we have to get a beat on, and we want to communicate. But this is not just unique to HHS and DOE. It's unique, like community college system working with the university system. It's like when I go to Dartmouth Hitchcock, and I got one office billing me here and another office over here dealing with orthopedics or something, you don't have a hot clue what happened upstairs. And so it's a lot of silos out there. We need to have data processing and systems there where they're talking with each other. And I just don't think we've moved there. We need to. This would save, I think this would be a tremendous boon to help if we could have this discussion where you can integrate more closely with each other. So yes.
Right. Thank you very much.
Yeah. So Representative Peoples, and then Representative.
Just to follow on with what Representative Luno said, I'm looking at this and I see that we're creating another class of people, right? So 1 in 4 students is Medicaid. So we're going to get the data on one class. What we need to is expand this so that we collect the same data for all special education students, including the Medicaid students. So we need to know what we're collecting across the whole spectrum, and it needs to integrate up and down between the DOE, the school districts, DOE, and HHS. At the same time, you mentioned the community college and our CTE programs. We could develop the specialists that we need to do that billing, or like billing coders that go to a medical, that are medical billing coders. There's classes for them to do that. If we have a program that's integrated from the bottom all the way to the top here, we have the educational structure that they can put together a curriculum and train the people we need for these jobs to collect the data so that the legislature and the administrations can make intelligent decisions based on real bona fide information. Like we talked about speech therapy and things.
I think you're right on, but what we're talking about is it's going to come back on the legislature. In many of the cases, our statutory language says you may communicate and between even the district and the state. And so I think it behooves us to really look at that and say, well, maybe we have to make some legislative changes where, we've had it with the Special Education Advocates Office as well, trying to access certain things. And that's been worked out through memorandum of understandings and working cooperatively between DOE and that person. But between the local school districts and DOE, yeah, I think that there's a need to really look at what we have written in our statutes. I think we've been very cognizant that local is local. And even with some of those emergency management plans being submitted to Homeland Security, a few districts are refusing to do it. So it comes down to to us, where we are. Representative Spilsbury.
Yeah, I think,
Representative Damon was first, and then Representative Spilsbury.
Thank you both.
Yeah.
I think I'm backing up a bit in the conversation and wondering, does the RFP include anything related to in-district training on how to do this? And thinking also relative to Representative Peoples' comment, there already is a coding certification process for medical coders that I recall in the recesses of my healthcare professional mind. I don't know if that applies to this as well. So that's sort of two questions.
I'm sorry, just was thinking about this, sort of the second part, but what Representative Peoples was saying, that when I've looked at one of the states that I looked at as an example of making a transition was the state of Colorado, and they formed a cooperative to support. That's an independent cooperative that that supports school districts in mastering the program and dealing with different topics. I think that the issue, we have a structural issue in terms of 172 school districts that I think your Representative Peoples was talking about. Is there a way to provide supports in a different way? Because while the RFP will show them how to deal with the component of doing cost report and time studies to support higher level claiming, there's more to it than just that. There's the individual billing and so forth that goes on, and appropriate documentation and such. So I do think that it is a challenge, just based on how we're not going to change local control. I know that's true in terms of that's inbred in a culture, but is there a way to provide, does this transition suggest we need, to the benefit of all, some sort of higher level of technical assistance than, because I, as a payer, I can't tell you what to put on a claim. There's our role as Medicaid, the payer, we can't sort of tell you how to do your business. You kind of have to learn that piece of your stuff yourself, if you will. And so I think that I think in part what we're going to learn maybe out of this process is that maybe we need something like for all other types of providers. Like I have the hospital association to go to, I have the nursing home associations, I have the county but schools are just kind of at this point. I have the Department of Education to go to, but they don't do the billing for the services, and I do learn from them certain things, but there isn't really like an association that helps schools master the entirety of Medicaid. Certainly there's special ed leaders in the state, but we don't really pull it all together in a place to support this. And I do find sort of the most rewarding work is working across agencies in the state that I found. I work with the Department of Revenue on tax issues related to hospitals and nursing homes. I deal with right now with the prison system, the Department of Corrections on implementing a new Medicaid opportunity there. We're going to be bringing that to the counties, but it's each one is a little bit different, and you have to, since Medicaid isn't 100% of what they do, we have to fit what we do that's not disruptive to the rest of what they're doing. And so it's a challenge, but it's the most worthwhile work we do.
Representative Spilsbury.
thank you. Yeah, I think we're on an extremely important theme here, so I want to build on what Representatives Ladd, Peoples, and Damon have just said. I asked before, so through DHHS, when we look at Medicaid claims, we're only capturing a portion of the data that this committee wants to see regarding the overall special ed expenses. And silos, build a broader program. I am guessing that the department, because it's already received the $2.5 million grant, it's already issued an RFP, is on its way to a purpose-built, narrowly focused, the mission driving it being the Medicaid billing and reimbursement process. And that's how silos get developed, because we proceed where the money supports an effort, one mission at a time. So to make a very loose connection, I was listening to a very interesting interview that Brett Baer did of a panel of some of the people involved at a senior level in the DOGE effort. And one of them made the observation that in the United States Department of Health and Human Services, I believe I'm getting the numbers correct, but approximately, there are 71 different
710.
710, no, wrong by a magnitude of 10. 710 distinct databases and software programs, and there are 27 different CIOs. So this kind of disaggregation of data has become historically a disadvantage. And I hope we're not just marching into that same problem, because the committee, of course, has formed this subcommittee to ask the broader question about what's going on with special education overall.
So I think we
Seems
have,
helpful, but not complete.
we have 7 divisions within the Department of Health and Human Services covering the entire landscape. But our IT as a state is the Department of Information Technology. We're integrated into there. Our infrastructure is managed through the Department of Information Technology. We don't have a separate running of that. So I work directly with my team works directly with the DOIT folks in terms of what we're doing. We don't we work together on that. I think that in architecture, form follows function, and finance, form follows financing. In part, I think the way that things get organized is, the grant opportunities there in a specific kind of window, or the way that for example, I describe as a collision between the federal education rules and some of the HHS rules that we were working through at the time in terms of how, back in 2019, there are some things that don't line up perfectly. So between the regulatory structure and the financing structure, it's how do you get beyond that to have the information to better manage. And so I do think that there's opportunities for us to, between collaboration of the legislature, Department of Education, local school districts, and Medicaid, to do more for our students and for the state. So I want to be here to help get that conversation going.
You talked about the program in Colorado to help communicate. In terms of we have 107 SAUs in this state, along with a lot of small districts within those SAUs. But we also have a department over at the Department of Education, a bureau, or whatever you'll call it over there, special education. Would it be easier if if you have a student coming into small district A, for small district A to directly contact the Department of Education saying, how do I work this? How do I deal with the issue of continuing this student's IEP? I don't have the personnel. And then directing that district to somebody at HHS, but also to DOE to be working with, well, we have on board a licensed nurse that may not be in your district that can help supervise this program. I'm just trying to figure out how to get this working smoothly so more districts are participating. Is it best working through you directly with the districts, or you working with DOE and the districts?
Yeah, I think it's got to be the latter, and maybe even a little bit different than that in terms of like a technical center that that could interface between DOE, the schools, and but we don't want to create another overhead structure that sort of takes things out of it. But I do think that for smaller districts to participate, that some of them do need a different way to, I mean, SAU's formed, right, to consolidate certain functions, right, to try to get some efficiencies, I think.
Special ed being one.
Yeah, so I think that similarly, that I think some of the small districts probably can't master this maybe on their own because they don't have the resources to do it. And then the question is, how much are we sacrificing there? And does it make sense to do that?
Thank you. Are there any further questions from, we're getting, when I talked to Mr. Lippman just last week,
Friday?
I said, maybe 45 minutes. We are now gone quite a while. Representative Spilsbury.
I hope that I've revealed my confusions because you've done a great job of clarifying. Thank you.
Yeah, it's, any other question? Representative Luno.
So, thanks, and thanks so much, Henry, for being with us today. I think it's sort of a follow-on to what Representative Peoples was asking too. But when we start to look at all students that have, IEPs or 504s or are receiving medical services, directed through a physician, while they're at school, maybe through a OPLC licensed staff member, maybe from a contract service, maybe from the school nurse. If those services are potentially Medicaid to schools eligible, for a student who's not Medicaid enrolled but may have private health insurance through family member, could those services potentially be covered through the family's insurance?
I want to say a qualified yes, but I think that depends on how the policy is written,
right.
And so I think there's that's another. I mean, there's another
Right.
silo to be heard from, I guess, in terms of what the regulation of insurance in our state was.
Maybe through the insurance department.
Yes, but I think part of the activities that the department does is coordination of benefits and third-party liability and such like that. Medicaid is supposed to be the payer of last resort,
Right.
and so we do have controls in place to look for that.
Okay, no, I appreciate it very much. Thanks very much, Henry.
Well, that just brings up another whole question. If I go back to this 5B again and talk about and determine the Medicaid and other funds are obtained prior to requesting special education funding, that comes from Arkansas. That's in their regulations. They require the other funding, and I've oftentimes asked, what is other funding? You have the Medicaid, yeah, I understand that. Does that mean that if you have an IEP where a student's in a public school and the child is now in a residential placement or in a hospital type situation or homebound with 504, does it mean that the private insurance that family has may be called into paying or costing out part of this IEP due to the fact that Medicaid won't cut in first until the private's taken care of?
Yeah, I think it's not my area of expertise, but I think that part of the the effort that we do, and it's not my area of expertise. I'll say it again: is we have people that specialize in looking at coverage issues and making sure that if another, think about the simplest examples like a workers' comp claim versus a medical claim. If there's we have some children that are covered, dually. They may be have Medicaid and another insurance, like particularly kids that are severely disabled that are being kept at home. They may qualify for Medicaid and in part as well. So it's kind of looking at that to make sure that Medicaid is the payer of last resort, if you will.
Thank you. Any other? Okay, we're questioned out and, oh yes, Representative Calcon.
Thank you, Mr. Chairman. Can I just go back to the school districts and the little bit of the lost money or the money left on the table there? How many school districts do we have in New Hampshire? I mean, do we have 234 districts, one for each town, one for each? We don't, right? So how many districts do we have?
I thought it was 170 or so.
All right, so and the number I wrote down is we have 172 that are currently enrolled in the Medicaid plan. So we're right there. So can I ask for maybe recap? Why do we think that there's roughly 50% of Medicaid claims that are left on the table there as unclear? Is it because of a multiple of things? Or do we have districts that are not enrolled? Is it because of a training issue maybe on how to bill? Are we leaving things unbilled? I mean, where are we seeing this 50% roughly? I mean,
So there are two 50% we've talked about. The first 50% is that for those that do bill today, getting the 50% of real cost. Looking at historically where Medicaid schools has been, sort of pre-pandemic, that we've seen a decline in the frequency that's being used. And so some of that's related to the complexity, I think, that came around the time just before the pandemic kicked in. And I think part of it is that, districts have challenges mastering the program. School districts have, I think, other issues that may impact whether they have enough students to justify making the investment to have someone staffed to run it. But I don't know that we have the full understanding as to the why, but it just seems like, when you see one, if you think of like a hydraulic, we got one hydraulic going up quite a bit and the other hydraulic going down. I'm speculating that there's some correlation between the two to some degree.
so is the 172, are the 172 districts that you have enrolled, are those all of our school districts? Or do you have
There's-
some that are not actually enrolled?
From what I recall, there's like maybe 6 or so that aren't enrolled, and that's a recollection, but the large majority are enrolled. The number that are actually utilizing it has come down.
Thank you very much. And some of these questions, we will have DOE here, and they may be appropriate to go that direction to get this information. Anything else for Mr. Lipman? I want to thank you very much for coming in today, Henry.
You're welcome, and
Just off the cuff, I asked Henry to come in, what was it, last Friday?
Friday.
Friday, yeah. We're starting the subcommittee and we, have this one aspect we got to look at. And so I'm sure we'll be looking at it further, and you're always welcome to come back.
I'd be happy to. I think it's a important topic, and I'll work to get the RFA and the RFP to you. I think I can just use if it's okay, use the website email addresses to get that to the committee.
The best way to get to us is through Jen here.
Perfect, John. Thank
Henry, do you know Jennifer Four?
you. We've been in touch, yes, virtual. Nice to meet you.
She's our researcher /
Great.
attorney.
Great.
Okay, thank you very much, and I appreciate it.
Yep. Well, thank you for inviting me. Take care.
What we're going to be doing right now is we're going to take the last few minutes here today. Is there anything that DOE has right now? I know, Melissa, you called, I talked with you, and I'd asked that Rebecca, and of course, she's unable to be here today. And there's certainly going to be a lot of questions that generate from what we heard today from HHS, that perhaps what we want to do is have a further discussion with DOE at a separate time, but go ahead and take the chairs, and if you can offer us anything in line with what we've been discussing today for clarification purposes, or we can hold off too.
I think it's one point that wasn't mentioned is parents have to consent to billing Medicaid for any services delivered at the school. So that's one thing. So if you're looking at legislation and requiring schools to go the route where they're participating, just keep in mind parents can decline participation.
We understand that.
Okay.
We understand that totally.
Okay.
And that would be done through the IEP process, correct?
It's a separate consent.
It's Medicaid consent.
I understand it's Medicaid consent, but the parent may come in saying, I want this type of service delivered to my child, and the IEP team may agree that that child needs that. But then that service is going to then be cost out or reimbursed through Medicaid.
No,
If you're,
there's a document that they give to you that you have to sign off on
Yeah.
saying that you will allow the school to seek out that reimbursement.
Yes,
So the
yes.
parent, regardless of whether the service is, like, that's not part of it, it's the, like, a school's not gonna say, no, we're not gonna do the services unless that's not gonna happen
No,
because that
I
wouldn't be
understand
FAPE.
that.
So
Yes. Yeah,
the other part, I think, is just to make clear, students that have a 504 plan, those students, whether they're getting reimbursement for Medicaid, that's not something that we oversee, so I'm not a part of that. That might have been a question for Henry. But for special education aid, you're not getting special education aid for students on a 504 plan. So that would not qualify. We would not reimburse for those, so.
Representative Luno.
So, thanks very much. And actually, I had a question that sort of came up when Mr. Lippman was talking about the $8.8 million that of federal of Medicaid reimbursement that went to schools in FY24. But does the department know if any of that 8.8, any of those reimbursed dollars were credited towards expenses that districts qualified for on a per pupil basis between 3.5 and 10 or more than 10?
So the 8.8 million, if they were reimbursed by Medicaid, it wouldn't have been paid out by Department of Education for special education aid. So they wouldn't have used that towards the reimbursement costs.
So just to be
But
be
their
clear.
match, they could use. So if they're having,
Right. So, so make sure I understand this. So essentially, the 8.8 was netted out by the school districts prior to submitting the per pupil costs that were between 3.5 and 10 and more than 10.
correct.
Okay, thank you.
Yep, that's got to come out. Anything further? How do school districts, when they're sitting at the IEP meeting, know what is coverable through Medicaid? Is that something that's done outside the IEP, or how do they know when there's an opportunity, we might get reimbursement through Medicaid here? And certainly the department, if we cross that $70,000 line, is going to look back and say, what? And I hope you are saying, why did you not seek Medicaid dollars for this school district?
So I think that you have school districts that have the means to have actual staff that can manage that program, manage that reimbursement system. Then you're going to have those school districts that do not have the capacity to manage those types of programs. And I mean, it's, as you heard about the process from Mr. Lippman, on a quarterly basis, the school then takes all of those costs, submits it to Department of Health and Human Services. They go in, evaluate it, review it. Then they take that, submit it to the feds review it. Then they turn around and give it, the funding that they say qualifies back to DHHS. Then DHHS will then go and give the money to the LEAs. At this point, that's a significant amount of time. And so what we've heard is a lot of the schools will say it takes too long to get that reimbursement, or it's just the process is so complicated that it hinders them to be able to participate. I think a lot of the systems that Department of Health and Human Services is looking at implementing is going to help support that so that it will make it easier at the local level to be able to submit those costs. But I think you're looking at some schools have the ability and the staff to be able to do that, and just some do not. And it's, if you're gonna have to pay a full-time person just to manage that system, they may not have that capacity or the ability to fund that type of work.
Representative Ludo?
So thanks very much, Mr. So that's not quite what Mr. Lippman said. He said in some cases, he said the state reimburses the districts for the federal share and then seeks reimbursement to the state from the federal government, and that in some cases the reimbursement to the school districts could even be same day. So I think were his words. So my question is, has there been any sort of like technical advisory or technical memorandum from the department to school districts about Medicaid to schools and what sort of things, are required for school districts? Mr. Lippman talked about, several things, knowing the Medicaid billing code, services must be provided by a licensed OPLC licensed provider or staff member that's OPLC licensed. I think Mr. Lippman talked about the documentation. Obviously, that parental consent, as you've pointed out, for not only the IEP, if it's a if the student has an IEP, but essential to have that consent through Medicaid. And then of course the timing of those reimbursements coming directly from the state to the districts. Is there a tech advisory, something like that?
Thank you for that question. So the department does frequent kind of TAs or support sessions for our special education directors. We have regular meetings where oftentimes too throughout the year we'll get together with the New Hampshire Superintendents Association and offer like technical assistance, and then they'll bring in some of those professionals that can talk from DHHS that can talk a little bit more about the specifications and all the requirements. But we do, our special education director, Becky Fredette, and her team often meet with those directors of special education, and that is part of something that they do talk about. But as far as us providing, is where we sit down and provide direct training or technical assistance, where we're sitting kind of side by side, showing them or training them how to do that. We don't do that, but we do talk to them about the offerings that DHHS has. And then DHHS does have I don't know, robust is the right word, but they do have a website that kind of goes through the whole, Medicaid to schools in New Hampshire and the kind of the process and the technical assistance. So they have guides that they're providing, and we tend to direct the school staff to them
Thank you.
since they are the experts.
Thank you, Mr. Chair. Yeah, I want to ask you a question, Melissa, that I asked Mr. Lippman before, and that is, am I understanding correctly that when the districts submit Cat aid claims, so they exceed the 3.5% multiplier, those are not netted down by Medicaid reimbursements? In other words, the school is submitting the total expenditures, and then their share can be further offset by the Medicaid reimbursements when received. Is that an accurate understanding?
I guess I'm not understanding it the way that that we see it, and the way that my understanding is that they'll look at their cost for the entire year. So this is why it kind of happens at the end of the year, because you have to look at the cost for the entire year. And so there's those pieces in there that they've been reimbursed for Medicaid that wouldn't be counting Medicaid. I know we're talking about it's by the state, but there's the by the Fed part, but the federal funds is what's being reimbursed to the schools. The state is not covering a portion of that and reimbursing it to schools at the DHHS level. So they take a look and they get that Medicaid piece. They're not including that part of it in their claim for special education aid.
So,
But-
so they're
So
not.
that aggregate,
So if a student cost $100,000 and they got $10,000 of Medicaid funds,
and they
you're
spend
saying they're only going to
90,000.
submit 90?
They're going to say 90,000 is what this student we're seeking, reimbursement. They have their percentage that they're covering, and then we're covering that above and beyond that 3.5.
And you're confident of that answer? And that's consistent?
I mean,
Because it's not what I would have
digging
guessed.
into all, yeah. So I think that is a solid question to ask. I think our ability to go in and analyze all of the invoices,
Yeah.
we're doing that. Are we matching it up against the Medicaid claims? No.
I guess I'm wondering whether it's a question that deserves further inquiry, because I assumed that the school is submitting the total expense regardless of where the sources for funding it have come from.
But we're reviewing all of those invoices at the granular level, like they're submitting, this is how much the cost for this student, and here's all their transportation invoices. So we're going through and looking at all of that. Here's what it costs for them to have their, speech therapy services. This is how much it costs for that paraprofessional. So we're going through and seeing all of that and then matching it to
But you're seeing the cost side. Are you also seeing the reimbursement side?
Yes. So the cost that we then reimburse, but their chunk, you're saying from the Medicaid piece of it, would we be matching that up? Probably not. I don't think we have the capability to match that up to the DHHS system.
So if I'm the district business administrator, I would submit my gross costs, wouldn't I?
Because those are invoices.
But they're going to then audit those invoices to ensure that you're not submitting invoices that have been reimbursed.
I think she just said that they cannot make the match of,
Right.
Well, it's been explained to me before that the way Melissa's, I think, trying to do it, I've been told over there that we look at these, we audit all those invoices to ensure that those invoices allow them to then exceed the 70,000. In other words, those monies, they've done their share. But they also subtract out of those invoices anything that's been reimbursed by Medicaid. That's how I've understood it.
That's my understanding.
so if I can just, how about we reserve this question and see if we can confirm it definitively?
Yeah, I think we need to.
Yeah, I
Yeah,
think,
Becky can come in
Yeah.
in a couple of weeks.
well, so Mr. Chair, I think it would also be good to maybe hear from some SBOs on how this is done, because I agree with what Representative Spilsbury is talking about here. And, in a cost accounting, program, you'd have all of your expenses, and obviously they're tracking by student. And some of these expenses are going to be Medicaid reimbursable, and when they get that revenue, that's just going into a revenue line, not necessarily tracking back to the student or even a particular
But again,
service invoice. So
special education aid, $50 million. Medicaid, 8.8, Medicaid to schools. So there's not going to be a significant amount of double billing either way you would look at it.
I would.
But when you're looking at these invoices though, and you're seeing that there is no effort on the part of that local district to seek reimbursement from Medicaid, wouldn't you catch that and direct that department, that district to start getting on?
We can't make them participate in the Medicaid. We can recommend it, we can refer them, but we can't make them. And I think it would be helpful too to get some folks in from maybe those schools that are not or those districts that are not participating, getting their perspective on why, and maybe what is the hindrance there, what is the barrier, and how can we remove those barriers so that they can participate and it's a seamless, easy process. I can just anecdotally go with what I have heard, in that it's not an easy process. It takes too long to get reimbursed, and it's not, worth it in the end. I don't know how accurate that is, but that's what I've heard.
Representative Peoples.
Yes, just to follow on when you pay the bills, do you guys, over at the DOE, use the rationale that the Department of Health and Human Services are using? Do you have a code, do you have a sheet that shows you that these are allowable costs, this is within reason? How do you say that bill for speech therapy matches the IEP and this is an appropriate amount of money to be paying?
So we don't have codes that we use necessarily, but if I'm going to pull up the amount here, when we look at what was actually submitted to us and then what we said was allowable, I think we got in around 100 million, and then we go through and look at it all, and we're like, okay, about 50 million is actually allowable. And we base that on looking at the IEP. If someone goes in and charges an amount that seems unreasonable, we can then say, you know, kind of, I mean, it's going back to Code of Federal Regulations saying it's not a reasonable cost, but I mean, we could look at that piece of it. But there are, I mean, a significant amount where we're saying, you're submitting these costs to us, but it's actually not allowable. We're not going to say that this qualifies, and we take that out.
Thank you.
How do you deal then, Melissa, with we had, right at the front side of this, we had discussion about true public school expenditures, actual costs. Actual costs A, actual cost B must be totally different for the same type of service. When you're doing that review, are you looking at that invoice in terms of that actual cost that might cost A and the cost is B, or are you trying to take some kind of an average according to your coding sheet? Or
No, it's actual cost.
it's actual costs?
I also think when we're talking about drafting new legislation, there might be some thought placed on, you know, if we're going to get into allowability for costs that can, you know, qualify for reimbursement for special education aid, if they're providing a service that's in district, does that necessarily qualify? Was the intent of special education aid meant to cover those students, or is it really meant to cover the cost of those students that were considered at that time catastrophic? So I think that's a piece that can be challenging for us because we have to go with the way the legislation is written, and it's going to be all the costs. But if we're looking at, okay, well, wait a minute, if it's really just for those students that are going, you know, we're intending to support when they get that kid coming in that they didn't anticipate for those costs, that is, I think, where you're going to see your difference.
Representative Spilsbury and then Representative Peoples.
So you're just prompting another, I realize I don't know the answer to this question even slightly, and that is, what percentage of students who exceed the 3.5 multiplier and get CAT aid are out of district placements? Is it nearly all of them?
No.
No. So do we have any statistics on that? How many of those students have their services provided entirely within district?
She's going to
I'll work on that and I'll send that.
Great. Don't need it now. Thank you very much.
Representative Peoples?
Thank you, Chairman. Thank you for taking my question. So just to kind of close up a thought bubble, my thought bubble, I'll pop it and let it bubble all over the room. A system from the school district level all the way up to the Department of Education and wrapping in with HHS, that everybody was following the same parameters, same set of rules, same set of definitions, same fee schedules, would make our system effective and efficient and save the state money by the sounds of it.
I would say an initial investment would probably, I mean, it's going to be that investment and we'll have some federal funds to match that investment, but in the end, it might end up being worth that investment. Not to throw any more wrenches into the system or throwing things out there, but I also think we have to take into consideration court-ordered placements and episodes of treatment. Because those costs and those children that are placed out of district placements that we're talking about, that's not part of special education aid. So those costs for those students that are court-ordered placed go directly, we receive those bills, those invoices directly from the vendor. So whoever's providing that service, the service provider sends it to Department of Education. We pay that bill directly to them. Same with the episode of treatment students. Those are not part of special education aid.
We have a section in our statute, though, where you look at the 3.5 to 10 and all that, where there's $250,000 earmarked for an episode of agreement or episode.
But we've never paid that out. We've never
I
done it.
understand that, but it's there.
Yes. So that could be cleaned up too
Okay.
with any legislative
Representative
changes.
Leno.
Thank you, Mr. Chair. Thanks very much for taking questions this afternoon. Since you do have, invoices for, or, records from school districts who are applying for the special education aid, formerly catastrophic aid, would it be possible for the department to look at those costs and look at those invoices and determine if the invoice was for educational services versus medical services?
We would look at that piece of it. So if it's a medical service to access their education, it does qualify. But I think that was something that Mr. Littman was trying to make clear, like the Medicaid costs are really for those medical costs, whereas
Correct,
we're
correct.
on the education cost side and so parsing that
Correct,
out.
but both education related services and medical related services are both part of the special education aid program when it's between 3.5 and 10 or above 10. So to get a sense, would it be possible to get a sense as to the percentage of these services that are above 3.5 are tied to medical services being provided through the schools?
Before I answer that, I'd want to take it back to the team to see if that is an analysis that we could do.
Okay,
And I'd want to take that to Becky as well.
okay. Thank you. Would that be something that?
Yes,
that we
yes.
wanna get
Yeah.
handled?
I think that probably the next meeting we have, we'd like to have the department here so we can get through some of this. Talking about these service providers that must be licensed personnel to identify the Medicaid side of things. If, in fact, I'm a small district and I don't have that type of person, but I am a member of the SAU, and the SAU does have a special ed director, or it may even have some staff elsewhere within the SAU, which are like licensed nurses or speech pathologists. Can those people be used as the service provider even though they're not in that district?
Want to answer that?
Yeah. So I know, for example, SAU 7, very rural, Pittsburgh, Colebrook,
Yeah.
those districts, they all contribute towards the contracts for the SAU staff so that those staff can then support all the districts within the SAU. So they'll hire them as an SAU level person paid for by the different districts.
Okay. Do they all have, all these SAUs, all 107 of them have special ed director?
Some of them I know are dual directors and superintendents. Some of the smaller ones will have part-time people fill dual roles.
Ref Stamen and then Glenn. Go ahead.
It doesn't matter. This sort of goes back and it just popped into my head. Sorry, again. This goes back to what we were talking about before. What the very first thing that you said was SPED funds don't include 504, but Medicaid to schools could include 504s.
I would ask that question to Henry Littman. That's
Okay.
my understanding, but I'm not 100% on that.
Okay. Thanks.
Representative Damon?
Thank you, and thank you both. I'm going back to what I believe I understood you to say a few minutes ago, that there's not codes for the services that districts are submitting invoices to DOE for.
They don't match up with the Medicaid coding, but we
But
do
are
have
there
within.
like, if the district's providing, say, I don't know, OT,
We have like a
are
number
there
associated
state-specific
with
codes? I guess I'm just trying to understand, how do you
where they.
identify that something is a reasonable cost? How do you name the service if it's not a code?
So with the student information system, and this is a system that's what predates both of us. So the way that it had been put together at the time is that there were these codes for services, but then the districts could go in and put in something. And so we've got a situation now where when we're building our new system, we're not going to allow for the ability to go in and add things because we might have called something a speech pathologist and they might have changed it and worded it a little bit differently. It ended up becoming a system that had such a mess of all those different pieces. That could be why it takes a long time to go through and kind of match it up, but we're making sure that we are, that service is in the IEP, but going in and aggregating all of those costs to like a speech therapist, it may not be just one specific code that the Medicaid has, but do we have specific categories that they have to go in and select? Yes.
Yes.
I don't know if numbers is specific to a code, but
So there's not a correlation then between the way that districts are communicating to DOE and the way they would need to communicate to
DHHS.
DHHS for Medicaid. And is there any intent in the system that you're talking about building or working on building to have more coordination and less
Yes.
duplication, less multiple titling?
So we have, our commissioner has talked at length with Mr. Littman about building those new systems going forward. And so that the system that they're building can talk with ours. And so that in an ideal world, what would happen is a school district would submit everything, all the services for that student with specific codes. And then we would probably have like a third party vendor that would go in and do the evaluation and say, okay, these services are medical, these services here are educational, these these medical services, we need to pay for this with private insurance, or it needs to be covered by Medicaid. And they would do the billing and kind of parse it out for us and then determine what would qualify for special education aid, what would not. So that's the system we are aiming towards. But I mean, we're still several years out from being close to something like that.
One more.
Yes.
So in the meantime, what entity or how is it decided what is a reasonable reimbursement for a particular service?
So we go through and look at all of the invoices submitted to us. We look at if that service is in the IEP, and then that would make that determination, and we would be evaluating it that way, just as we've done in the past. If we want to make changes to this process, then we would need to look at legislation and possibly rulemaking, because right now a school can say, hey, wait, we did pay these costs. You have no basis to deny us. And so we can go by some of the language that we do have in our rules and what's written in legislature about what is allowable, what's reasonable, whether it's in the IEP. If they're submitting things that are not in the IEP, we're not going to pay for that. But really, we don't have the basis to completely say, you spent $200 on a speech pathologist and the average rate is $100. We have no way to deny them reimbursement for that.
Representative Peoples?
Yeah, kind of using Representative Luno's Wayback Machine. I have a question that relates to why you think this should take so long to bring into creation. Several years is a very long time, and millions and millions and millions of dollars. I sat on the Department of Labor website redesign committee years ago, and at that point they put together a committee of people, the vendor that was doing the actual design, people from the Department of Labor representing labor, and people from the industries that the Department of Labor deals with. I represented the elevator industry. There's another man from the fire alarm industry, and there's another man from the boiler industry. And we put that all together in less than 6 months.
So it would be cost. The state contributes zero when it comes to our special education student information system. I have to pay for that system entirely with my federal funds. I've got to position my federal funds strategically in order to be able to cover the cost of that. I was able to use some of the COVID relief funding to go towards the completely rebuilding that student information system, and that student information system will take at least 2 years. So we're about 9 months into the process. we still have another year and a half to go before it's implemented into the school districts. So the funding piece is part of it. When we look at special education aid, I, from the state, get 1 FTE, and then the state covers 0.25 FTE of my director, and that's it. Everything else is federally funded. So when we start to look at, is it cost effective to invest in building up the generally funded side of our special education team? Probably, but when we are looking at having to go in and analyze the special education aid, when I've got 1 FTE to do it and no system to actually parse this all apart, we hire in some part-time temporary folks to review all those invoices manually that are coming in. I mean, whether it's they're uploading it into a system or they're bringing it into us in a shoebox, we're still looking at it manually. So investing in a more robust team to do this work, you're going to get better results.
Thank you. I just see it as critical for us to make decisions on funding, to have the correct and accurate information. And it seems very put together by committee at this point without any way of really coagulating it into one common.
Yeah, give me the team
Report.
to do it, and I can't. Otherwise, I'm relying on my federal funds, and I honestly cannot tell my federally funded staff, you have to work on special education aid because that's a state initiative, and that's supplement versus supplant, which we shouldn't be doing.
Thank you. I appreciate it.
Boy, a lot of bells go up all the time. We're getting close to the end of where we should be today. I think we're into the lunch hour, but Melissa, I think we all have a lot more questions. I'd like to know, well, what are you budgeting for this? What are the costs going to be for this program? If we were, to look at our own budget right here in the house, what would we have to add to that to help you rather than having to, steal from this and that to make it all work? There's a lot there that we have to look at. And I think what we ought to do is just hold off any further questions at this point in time and invite the Department of Education back again, and we can formulate some questions too, which would maybe help you in knowing where we're trying to go. I think it's all around the funding of this program and how we can help out and help the unfunded mandate that's coming down to the local school districts. So with that, I would like to, take you off the hook right now
Sounds good.
and really appreciate it. Just, boy, you came in here following Henry Lipman, and now there's more that we would like to really head into. So, thank you so much. For the committee here, the reason why this subcommittee has been started, I explained earlier, because this is a issue which we need to move forward on, and time is not on our side here. So I'd like to have, if we could, another meeting 2 weeks from today, where we could then invite the department back then, and okay, when will she be back? And is there anybody in the finance side of things with Caitlin familiar with any of this, or it's? Yeah, that's what Brian mentioned to me. Okay. Yeah, I really think too that we need to have, when's Becky coming back? Okay. Okay, so today is what, the 31st? 2 weeks. It would be the 14th, right? Do you expect her back on the 14th? Okay. So what we'll do is we will try to have a meeting here within the next several weeks. Are there any other areas which we want to get into where if Becky's not back, are there some things we can pursue? There's a number of areas which this was just chipping off part of the iceberg here.
Yeah, thanks, Rick. I would suggest we might want to I mean, we talked about private insurance, so maybe somebody from the insurance department.
Oh, I'd like to have some of the directors from the
Yeah, you mentioned.
School
this.
business.
school
School
districts
business
come in
officers.
here and explain it. So this kid moves in. What do you do? What are the first things you look at? You look at the IEP, yes,
Yeah.
but then you notice in this IEP this, and of course, Mr. and Mrs. Parent has already mentioned that. And so, how do you handle that?
It would be good if we had 2 or 3 different special ed directors, like one from some of these rural districts and one from one of the larger districts, because I think different levels of staffing and different structures for how we do this.
Yeah,
I'm thinking the same
I
thing.
think this is critical.
And-
We need to hear it.
And
Yeah,
what about-
special ed directors, but also school business officers too, because they're the ones that are actually.
What I was thinking.
Well, and
Making the
the other question I have, because I have a daughter who does this, not in this state. And she has her C, she's a speech pathologist. But guess who does the Medicaid where she is? She does. And so that subtracts from her contact time with her caseload, which is over 40 kids, 45 kids. So is there what kind of support administrative staff do you need? The business
Right,
office.
right.
So we need to have those folks as well. But I'd like to also have a licensed person, which is the provider, come in, not just the administrative side.
Mhm.
So if we could set this up, I'm looking at time here.
And
Yeah.
can I ask a broader committee question of scheduling? So I see we have seven Senate bills that have been assigned to us.
Yeah.
They all, but for the EFAs, look like relatively brief.
Well,
Do we have-
we have one early bill amongst those 7.
Do we have
So-
a date? That's what I have in
I'll have to
mind.
put that in the calendar going out here.
Mhm.
I think we can have those hearings and, park a lot of those. Most of them are for technical
It
education.
looked to me like could pretty much set up that for one day of
That can
hearings.
be one day, but this right
And we
here,
may get a couple of more bills after the 10th.
there'll be a few more. But if we skip the 7th, that's next Monday, and went the next one, you're not on the committee, per se. Yeah, so on the 14th, pardon me? On the 14th, I have a 9 o'clock career technical education advisory council, but at 1 o'clock, I have nothing. Is 1 o'clock okay on the 14th?
Okay with me.
It's good weather, it just destroys a productive day.
Yeah,
I
it's
think
true.
10 is really,
Yeah.
regardless of which day.
Feel the same way.
And you outdoorsman. Okay.
I just think it's important because it seems like we've stumbled into a place where there's a tremendous amount of opportunity to
Okay, let's meet at 10 o'clock on the 14th. I will go to the 9 o'clock and cut out of there. That's right over at Granite State.
So tentative.
And I'll talk with Jeff and get the skinny what's going on prior to that.
Thank you.
You're on that too.
But I'm away that week. I'll be on a boat. Big boat.
Nice.
Yeah, we asked that to Caitlin the other day, the boat she was on to the Caymans. Uh, So we're gonna schedule this for 10 o'clock on the 14th.
Perfect.
Jen, can you get that in the calendar, please? 10 o'clock, 14. Yep, Karen. Is there anything else, just for everybody here, look at some of those thoughts that I put down there. I think under 5, A through I. Look those over and try to develop some questions for DOE, which we can sort of give them some guidance of where we want to go. Thank you very much.
Listening to this, having run business, and hearing all of the different pieces about what they've got to submit for Medicaid and what they get back in return, my first thought goes to, it sounds like we're spending an awful lot of money to submit to Medicaid for very little return. So we have to have licenses and